Now let's talk to Dr. Greg Petersburg as he shares his experience in this industry.
I'm Greg Petersburg, and I'm a physician in Tucson, Arizona. I specialize exclusively in preventive aging medicine and have been doing so for the last 10 years. You know, 10 years ago when I started in this field, I would have given anything to have a mentor or someone I could turn to for advice. And now 10 years later, I find myself in that position to be able to offer that. So I lecture and teach internationally in this specialty, and I train physicians. As part of the work that I do, it includes sometimes lecturing with the WorldLink Medical conferences, and I try to encourage all of the physician clients that I have worldwide to participate in the WorldLink program. There are a lot of other options out there that folks can get for their training, and this is clearly the best for the money that there is when you're looking for your CME programs. But even after finishing part one, everyone is able to start seeing patients right away. It's not theory, this is practical stuff. It not only changes the behavior, it changes the paradigm. This is a whole new paradigm of medicine. You know, the difference between what all of us were trained to do in medical school versus what we're doing here in preventive aging and age management is a new paradigm. It's moving from sick care to health care. It's moving from what I've come to think of as downstream medicine to upstream medicine. And this is a real exciting time, and Dr. Rouzier does a fabulous job helping prepare docs with the tools they need to move their practices upstream. You know, 75 to 90% of all diseases that we spend money on in this country are preventable. They're avoidable and unnecessary. So if we want to help individuals to take charge of their lives, that means changing everything. The way they feel, the way they think, the activities they engage in, the foods they eat, the air they breathe, and sometimes that involves helping them with their diet through nutritional supplements. It's a part of the puzzle. Well, I will reiterate that the majority of the diseases that we spend money on in this country never had to happen. 90% of all heart attacks are preventable. 90% of all strokes, 95% of all type 2 diabetes, 75% of all cancers, 75 to 90% of all Alzheimer's diseases, and the list goes on and on and on. Each one of us can take charge of our lives if we approach it from the standpoint of wellness rather than sickness. Waiting for a cure from a drug company is not the answer.